An estimated 56,000 people in South Africa and 1.25 million around the world died of tuberculosis in 2023. This is according to recent figures from the World Health Organization. Now, following the COVID-19 pandemic, the Health Department in South Africa said it had noted that the TB care cascade gaps have increased, with fewer patients tested, diagnosed, and successfully treated. A TB recovery plan has since been developed to address these gaps. The version 2.0 of the TB recovery plan is aligned with the National Strategic Plan of 2023 to 2028 for HIV, TB, and STIs. For more on this, we're now joined by Bada Pharasi, CEO of the Innovative Pharmaceutical Association of South Africa. Good afternoon to you, sir, and thank you so much for your time. So let's start our conversation perhaps by just unpacking some of the innovative ways you think need to be prioritized to meet the WHO and the UN milestones to end the TB epidemic, especially when you consider the gaps that were caused by COVID-19.
Good afternoon, Onati. Good afternoon to your viewers too. Among the innovative ways that should be resorted to, and I think South Africa hasn't done too bad in that respect, considering that we have developed in South Africa, and this is a first for South Africa, the Desmond Tutu Health Foundation actually came up with a test that can be conducted in the comfort of one's home. It is something that they refer to as Gene Expert Edge. So healthcare workers actually go to the home and carry out the test at the home, and that's very convenient. They go there after some health workers would have gone around and detected that there might be somebody who has displayed symptoms of TB in a particular household. The other kind of innovation in this respect has been mobile X-ray technologies that have been used. And lately also, there's been testing of a vaccine for tuberculosis, and it's been tested on patients in South Africa, Kenya, and Zambia. So there's quite a lot that's happening within the research and development industry.
Do we have an idea at all in terms of where the majority of the gaps lie in as far as the landscape of South Africa is concerned? I'm asking this question specifically because there are questions of how can we ensure, that the innovative TB treatments reach those who need them most, especially as fewer patients, as we've said before, were tested, were diagnosed, and were treated during the pandemic.
Well, among the gaps that one sees is the fact that some households are so congested. People who live in such congested households, people who go to health facilities where good infection control is not in place. Those are the kind of places where one is likely to contract TB. And when this happens, people should look out for symptoms such as persistent coughing, and generally I would advise that when you go out into public places that are crowded, just use masks. And if you don't have to go into those places, just avoid going there. The difficulty, of course, is that you also have refugee camps or people who are in such places, such as immigrants. They tend to be crowded, and lack of hygiene also leads to those people being susceptible to infection with tuberculosis.
And in terms of initiatives, what initiatives or programs should healthcare providers, government even, and the private sector, in fact, focus on to make screening and diagnosis a top priority? Because you'll find that most oftentimes people don't know what symptoms are presented to them and how urgent they should be treating those symptoms.
The government itself has a TB control, TB control program. And unfortunately, we do not have enough healthcare workers to go around. The best way of ensuring that we can detect TB would be if we had those community-based health workers could be used to go around communities, especially in the rural areas, people who do not have access easily to healthcare facilities. Those would be people who then do the rounds and look out for those with symptoms of tuberculosis. But I think it's a war that cannot be won by government fighting this alone. It's got to be collaboration between government, the private healthcare sector, academia, and everybody else who's interested in the healthcare of the country. It's collaboration also that requires us to learn the best ways of combating TB from global examples. We need to constantly look beyond our borders to learn of best ways of treating TB around the world.
And just as we wrap up our conversation, of course, there are worrying trends, particularly as it relates to, TB being prevalent among people living with HIV. What strategies should then be implemented there to curb this trend? Especially worried about the goals and the feasibility of meeting these goals with this version 2.0 of the TB recovery plan. I mean, the deadline is 2028, supposedly.
Yeah. The important thing is to, when you look at the fact that South Africa is the biggest HIV treatment program in the world, and one would say that in the last few years, more than 10 years, in fact, South Africa has been able to treat many people, and it is no longer such a big deal to have people going for treatment and no one is able to detect that they have HIV. The important thing is for us not to let down on treatment and constantly checking for people who might be living with HIV. We have to constantly be sure that we treat it successfully, because it is those people who have HIV, who live with HIV, who are really susceptible to contracting TB as well. So continue treating people who live with HIV, continue testing, encourage people to go for tests when they suspect that they might have HIV, they might be living with HIV.
Absolutely. Thank you so much, sir, for your time this afternoon. Really do appreciate it. Bada Pharasi, CEO of the Innovative Pharmaceutical Association of South Africa.